ഒഫീഷ്യലി ആദ്യത്തെ ക്ലാസ് തുടങ്ങുകയാണ്. ഫസ്റ്റ് ക്ലാസ് ഇസ് യോഗ ഇൻ എൻഡോക്രൈൻ ഡിസോർഡേഴ്സ് എന്നുള്ള ക്ലാസ് ആണ്. ഇത് എടുക്കുന്നത് ഡോക്ടർ ഗീത മേനൻ. നമ്മളെ ഫാക്കൽറ്റി ഇൻട്രൊഡക്ഷൻ പിന്നീട് പറയുന്നതായിരിക്കും. ഇവിടെ എത്തിയിട്ടുള്ള എല്ലാവർക്കും എറണാകുളം ഏരിയയുടെ പേരിൽ ഒരിക്കൽ കൂടി സ്വാഗതം പറയുന്നു. അപ്പോൾ ഇന്നത്തെ ക്ലാസ് നമ്മുടെ അക്കാഡമിക്കലി നമുക്ക് വളരെ അധികം എല്ലാ ഏരിയ ഭാരവാഹികളും അതുപോലെ തന്നെ ജില്ലാ ഭാരവാഹികളും എല്ലാവരും എത്തിയിട്ടുണ്ട്. ഞാൻ ഡോക്ടർ ഗംഗ ശശിധരനെ ഈ ഇവിടുത്തെ പ്രോഗ്രാം മുന്നോട്ട് കൊണ്ടുവന്നതായി വേണ്ടിയിട്ട് ക്ഷണിക്കുന്നു. ഡോക്ടർ ഗംഗ. ഗംഗ കേൾക്കാമോ? ഗംഗ
കേൾക്കാലോ മാം.
ഓക്കെ ഓക്കെ. ക്യാരി കൊണ്ടുപോയിക്കോളൂ, മുന്നോട്ട് കൊണ്ടുപോയിക്കോളൂ. സ്റ്റാർട്ട് ചെയ്തോളൂ, പ്രോഗ്രാം സ്റ്റാർട്ട് ചെയ്തോളൂ ഗംഗ.
ഇത് ഞാനാണ് മാം, ഐശ്വര്യ.
ഐശ്വര്യ. ഓക്കെ, ഡോക്ടർ ഗംഗയ്ക്ക് സ്റ്റാർട്ട് ചെയ്യാൻ പറ്റുന്നില്ല. ഐശ്വര്യ ഒന്ന് ഹാൻഡിൽ ചെയ്ത്.
അയ്യോ, ഞാൻ ഇപ്പൊ കേറിയുള്ളൂ. എന്താ മാം?
ഓക്കെ, ഇന്നത്തെ പ്രോഗ്രാമിനെ കുറിച്ച് ഒരു ഇൻട്രൊഡക്ഷൻ. May I request all of you for a silent prayer for a minute, please? Kannadachar silent prayer. Thank you. Dr. Aishwarya, can you do the welcome address?
Hi, yes ma'am.
Yes, please.
Hi, good evening one and all. This is Dr. Aishwarya. This is medium in English, no ma'am? Is there anyone from outside or should we continue with Malayalam?
As of now, no. As of now, no. You can take on with any language.
Okay. So good evening everyone. This is our second series of second session we have done with in connection with the yoga day. At the same time, this is our first session connecting with the academic session of Ernakulam area. So I heartily welcome one and all. I welcome our Dr. G.K. Menon sir, President of Ernakulam area, and also I welcome Jaymon sir, who's our district coordinator in academic session. Ajit Kumar, Joyce Doctor is there with us. I welcome Joyce Doctor to this session. He's our president, district president. And also Valsala Devi ma'am. She's our state executive member of our area. And also today, Dr. Tindu Doctor is also there with us. I welcome Dr. Tindu also to this session. And I think all other coordinators of this session is also there. Anavadya Doctor, Ganga Doctor, and also Harish Doctor. I welcome all you three also to this session. And moreover, today we have our speaker, Geeta Menon, ma'am, and I welcome you also, ma'am, to this session. I hope I have not left anyone else. I think some few, I think Ajit Doctor and few higher faculties of our areas also join. So I welcome each and everyone to this session. Hopefully, we'll have a very good academic sessions from here, and all the best for the academic team also. Thank you. Thank you, one and all.
Thank you. Thank you, Aishwarya. Dr. G.K. Menon, presidential address, please, in a few words. Dr. G.K. Menon.
Good evening, one and all. Am I audible? Am I audible?
Yes, Doctor. We can hear you.
നമ്മുടെ ഇന്നത്തെ രണ്ടാമത്തെ ക്ലാസ് ആണിത്. ഇവിടെ എത്തിയിരിക്കുന്ന എല്ലാവർക്കും, പ്രത്യേകിച്ച് സ്റ്റേറ്റ് എക്സിക്യൂട്ടീവ് മെമ്പർ ഡോക്ടർ വത്സല ദേവി, സീനിയർ ഡോക്ടേഴ്സ് ആൻഡ് ഡിസ്ട്രിക്ട് പ്രസിഡന്റ് ജോയ്സ്, ഡിസ്ട്രിക്ട് സെക്രട്ടറി ടിൻഡു, മറ്റിവിടെയുള്ള എല്ലാ ഡോക്ടർമാർക്കും എൻ്റെ നമസ്കാരം. നമ്മുടെ ഇത് രണ്ടാമത്തെ ക്ലാസ് ആണ്. എല്ലാവർക്കും അത് ഒരു ബെനിഫിഷ്യൽ ആവട്ടെ എന്ന് ആശംസിക്കുന്നു. കൂടുതലൊന്നും ഇപ്പൊ പറയുന്നില്ല, ഇടയ്ക്ക് പറയാം. ഓക്കെ, താങ്ക് യു.
Thank you, Dr. Menon. We have a senior member and former president of Ernakulam town area, Dr. Vasanthi, with us. Dr. Vasanthi കേൾക്കാമോ അല്ലേ? ഒരു ആശംസ ഡോക്ടറെ, വാസന്തി ഡോക്ടറെ. ഡോക്ടർ വാസന്തി, ഡോക്ടർ കേൾക്കാമോ? ഡോക്ടർ മ്യൂട്ടാണ്. ഡോക്ടർ വാസന്തി മ്യൂട്ടാണ്. സജിൻ, ഡോക്ടർ വാസന്തി ഒന്ന് അൺമ്യൂട്ട് ചെയ്യാവോ? ഓക്കെ, ഡോക്ടർ സംസാരിച്ചോളൂ, കേൾക്കാം.
Good evening, dear friends. I think the first session over, then only the Ashamsa is better. The first session allow her to do the work. Then after that, I will give you the Ashamsa. That's better, I think, because both are my friends.
ആശംസ മാത്രം ഡോക്ടർ ഒന്ന് ഒരു 1 or 2 വേർഡ്സിൽ 1 or 2 സെന്റൻസസിൽ പറഞ്ഞാൽ നന്നായിരിക്കും.
Anyway, Dr. Valsala,
just 1 or 2 sentences.
Okay. This is the first academic session. I think I heard about from Dr. Valsala. That is the first session of Vaidya Samisha. I'm giving all the best wishes for Dr. G.K. Menon and Mrs. Dr. G.K. Menon. Thank you. I will talk to you after the session. Give me 2 minutes.
Dr. Vasanthi. Dr. Ganga, can you please introduce the faculty?
Okay. Hello.
Yeah, we can hear you. Please carry on.
Dr. Ganga said after the session 2 minutes give a talk. I think so.
Yeah, sure. We'll do, doctor.
Okay. Thank you, Dr. Valsala. Thank you to all.
Yeah. Dr. Ganga, can you please introduce the faculty? Dr. Ganga, കേൾക്കാമോ?
അൺമ്യൂട്ട് ചെയ്യണം.
ഡോക്ടർ ഗംഗ, സജിൻ, ഡോക്ടർ ഗംഗയെ ഒന്ന് അൺമ്യൂട്ട് ചെയ്യാവോ? സജിൻ,
ഓക്കെ. പറഞ്ഞോളൂ ഡോക്ടർ, പറഞ്ഞോ.
ഡോക്ടർ ഗംഗ സംസാരിച്ചോളൂ.
ഞാൻ ഡോക്ടർ ഗംഗ, NHM ആയുർവേദ മെഡിക്കൽ ഓഫീസർ, പറളി, പാലക്കാട്. കേൾക്കാമോ?
കേൾക്കാം, പറഞ്ഞോളൂ.
പറളി, പാലക്കാട്, NHM മെഡിക്കൽ ഓഫീസർ.
ഓക്കെ. ഡോക്ടർ ഗംഗ ശശിധരൻ ഫ്രം എറണാകുളം അല്ലേ?
അല്ല, ഞാൻ ഡോക്ടർ ഗീതാജി മേനോൻ ക്ലാസ്മേറ്റ് ആണ്.
ഓക്കെ ഡോക്ടർ.
ഡോക്ടർ ഗംഗ റിയൽമി XT ആണ്. ഡോക്ടർ ഒന്ന് അൺമ്യൂട്ട് ചെയ്താൽ സംസാരിക്കാം.
സജിൻ, ഒന്ന് റിയൽമി XT അൺമ്യൂട്ട് ചെയ്യാവോ?
ഓക്കെ.
റിയൽമി XT. സജിൻ,
അൺമ്യൂട്ട് ചെയ്യാം.
ഡോക്ടർ ഗംഗ അൺമ്യൂട്ട് ചെയ്ത് സംസാരിക്കാവോ? കേൾക്കുന്നുണ്ടോ ഡോക്ടർ ഗംഗ?
ഡോക്ടർ കേൾക്കാമോ?
യെസ്, കേൾക്കാം, പറഞ്ഞോളൂ.
അപ്പം നമ്മളുടെ ക്ലാസ്സിന്റെ ടൈം ഏകദേശം അടുക്കാറായിട്ടുണ്ട്. അങ്ങനെയാണെങ്കിൽ നമുക്ക് തുടക്കം തന്നെ നമ്മുടെ മാഡത്തിനെ വിളിക്കാം. ഇന്നത്തെ ഫാക്കൽറ്റി ഡോക്ടർ ഗീതാജി മേനോൻ ഡോക്ടറാണ്. നമുക്കറിയാം, നമ്മുടെ GK സാറിന്റെ വൈഫാണ്. ഒപ്പം ഡോക്ടർ മെഡിക്കൽ ഡയറക്ടർ ഓഫ് ഡോക്ടർ മേനോൻ മാധവ ഫാർമസി ഹോസ്പിറ്റൽ മട്ടാഞ്ചേരിയിൽ, ഒപ്പം ബ്രാഞ്ച് ഫിസിഷ്യനായിട്ട് കേരളീയ ആയുർവേദ സമാജം ഹോസ്പിറ്റൽ എറണാകുളത്തും വർക്ക് ചെയ്യുന്നുണ്ട്. അപ്പം ഇന്ന് ഡോക്ടർ നമ്മളോട് പറയുന്ന ടോപ്പിക്ക് യോഗ ഇൻ എൻഡോക്രൈൻ ഡിസോർഡേഴ്സ് എന്ന ടോപ്പിക്കാണ് നമുക്ക് ഡിസ്കസ് ചെയ്യുന്നത്. ഏറെക്കുറെ നമുക്ക് ഈ ഒരു സബ്ജക്റ്റിനെ പറ്റി വലിയ ഒരു നോളേജ് വരാൻ ചാൻസ് ഇല്ല, കാരണം യോഗയൊന്നും നമ്മൾ കൂടുതലായിട്ട് ചെയ്യുന്നില്ല. അപ്പൊ ഡോക്ടറിൽ നിന്ന് തന്നെ നമുക്ക് കൂടുതൽ ഈ ഒരു ഇന്നത്തെ കാലത്തുള്ള ഈ പറഞ്ഞ അസുഖങ്ങൾക്കും പുതുതായിട്ടുള്ള എൻഡോക്രൈനൽ ഡിസോർഡേഴ്സിനൊക്കെ നമുക്ക് ഡോക്ടറിൽ നിന്ന് തന്നെ നമുക്ക് അറിയാൻ സാധിക്കും. നമ്മളുടെ പ്രാക്ടിക്കൽ വൈസിൽ നമുക്ക് എങ്ങനെ അത് ചെയ്യാമെന്നും ഡോക്ടർ നമുക്ക് പറഞ്ഞു തരും. അപ്പം ഞാൻ ഡോക്ടറിനെ സ്വാഗതം ചെയ്യുകയാണ്. ഡോക്ടറിനെ സ്വാഗതം ചെയ്യുന്നു. ഡോക്ടർക്ക് ക്ലാസ്സിലേക്ക് എനിക്ക് തോന്നുന്നു സമയം ഏറെക്കുറെ നീങ്ങിക്കൊണ്ടിരിക്കുകയാണ്. അപ്പം ഡോക്ടർ സ്റ്റാർട്ട് ചെയ്താലോ?
താങ്ക് യു ഡോക്ടർ ഗംഗ. ഡോക്ടർ ഗീത മേനൻ, നമുക്ക് തുടങ്ങാമല്ലോ അല്ലേ?
ഓക്കെ. Audible ആണല്ലോ? Am I audible? Okay.
Yes, very much, please.
So good evening to all. Respected President, Area President Dr. G.K. Menon, Secretary Aishwarya, Dr. Valsala Devi, Dr. Jaymon, Dr. Joyce, Dr. Tindu, Dr. Harin, Aishwarya. So, good evening. First of all, I express my sincere gratitude and thankfulness in giving me an opportunity for presenting the topic, role of yoga in endocrine disorders, or how asanas and pranayama make the endocrine system more efficient. To open the session with a prayer. Sahana bhavatu, sahanau bhunaktu, sahaviryam karavavahai, tejasvinavadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti. I share my screen. So, is it visible?
Yes, ma'am. Yes, ma'am.
Okay. So today our subject is role of yoga in endocrine system. As we know, the endocrine system maintains the balance in our body. They are ductless glands working tirelessly in your body to produce hormones that as they pass their secretion directly into the blood. So this is full screen now. It
Yes,
is
ma'am.
okay. Okay.
Yeah, okay.
So the endocrine system is comprised of network of endocrine glands and also some organs which have an important function with respect to this system. Endocrine system helps to integrate body system in conjunction with the nervous system by regulating and maintaining various body functions by synthesizing and releasing hormones, that is chemical messengers. It provides long-term regulation and adjustment of homeostatic mechanisms. It also assists the nervous system in responding to stressful stimuli. Let's see the major organs of endocrine system. They are located at the brain, that is hypothalamus, pineal gland, pituitary gland. In the throat, we know thyroid gland, and in the chest, it is thymus gland, and in the kidney, adrenal gland, and below that pancreas, and lower body it is ovary and testes, that is the gonads. These glands communicate chemically through hormones. Some work based on positive feedback and some work on negative feedback. Different glands perform different functions. This is, then the endocrine system helps to control the following process and system. First one, growth and development, then homeostasis, the internal balance of body system, then metabolism, body energy levels, then cell and tissue metabolism, reproduction, birth and lactation, response to stimuli, that is stress and or injury, absorption of nutrients, water and electrolyte balance, sleep, mood, etc. Hypothalamus located at the brain controls the pituitary gland. It is the center of emotions. We know pituitary gland hailed the master gland as it controls several other glands such as adrenal gland, thyroid gland, ovaries, and testes. The endocrine system going on that controls all our feelings, emotions, and reactions that happen in the body, from digestion, then energy release, reproduction, growth, sexual interaction, and many more. We call this the endocrine system, and in fact, it orchestrates the entire functioning of your body. The endocrine system constantly produces chemicals, sending them out into the bloodstream like the little messengers to tissues and organs so that they can work and do their jobs. Hormones are constantly changing in their level, and there are hormones that correct other hormones to exert or prohibit release in order to maintain that balance. Sometimes due to life stress, food, environment, etc., there can be reasons that hormones fluctuate in different stages of your life, such as puberty and menopause and pregnancy. However, a constant imbalance can lead to conditions such as we know, such as diabetes, hypothyroidism, hyperthyroidism, stress, etc. Keeping hormones in balance can be challenging, but there are many ways to help this process, including yoga. Then structure, we are all know structure. This we'll discuss. Then let's look at the endocrine glands in a glimpse. Hypothalamus, the bridge between nervous and endocrine system. Pineal gland is located near the third ventricle of the brain and has a rich blood supply.
ഇതിപ്പോ ഇപ്പോ പെരുമ്പാവൂർ ഏരിയയിൽ ഇങ്ങനെ 2-3 പ്രശ്നം വന്നപ്പോ ഇപ്പോ ജോയ്സും പിന്നെ അതുപോലെ വിനീത
Pituitary, it is tiny, pea-sized, situated in below the midbrain near optic chiasma. It has 2 lobes, anterior and posterior. It is closely connected with the hypothalamus via portal circulation. Next one is thyroid, the largest of all the endocrine glands, situated in the neck in front of the trachea. It has 2 lobes on each side. Next one is parathyroid, are 4 small pea-shaped glands attached to and behind the thyroid. Next, thymus. Thymus is located in the chest behind the sternum. Its size starts decreasing around adolescence. Adrenal gland, these are cup-shaped and above each kidney. There are 2 parts, outer cortex and inner medulla. Pancreas, flattened leaf-like structure below the stomach, has two parts. One is exocrine and other is endocrine. Endocrine part is made up of three types of cells, alpha, beta, and delta cells. Beta cells, also called the islets of Langerhans. Then comes gonads, are reproductive glands. In female, a pair of ovaries is present in the abdomen, and in male, a pair of testes is present in the abdomen. They are hung outside in the body in the lower abdomen so as to attain a temperature less than the body. Then endocrine glands, then the hypothalamus and emotions. Emotional behavior is an important function of the nervous system. Emotional behavior, feeling of pleasure, sorrow, excitement, etc., are performed by the basal region of brain called limbic system. It has been proved that hormones are responsible for a particular behavior pattern of the individual, and the secretion of hormones is influenced by intense emotional fluctuations. Hormones have a specific and important role in the development of a particular mood, attitude, temperament, and psychological makeup of a person. That is the science of psychoneuroimmunology. Hypothalamus plays an important role in controlling the endocrine glands through its control on the master gland pituitary. Thus, emotions play a big role in the function of the endocrine system, since emotions are closely linked with the hypothalamus. Emotions affect the target organ through the pituitary through HPO axis. Then, a quick glance on the functions of each gland. Pituitary gland, it has the anterior lobe and posterior lobe. Anterior lobe produce growth hormone that regulate normal body growth, then secrete prolactin, help in lactation, follicle stimulating hormone. It stimulates testes to produce sperm and ovaries to produce ova. Next one, luteinizing hormone, stimulate testes to produce testosterone and ovaries to produce progesterone and estrogen. TSH, thyroid stimulating hormone, stimulate thyroid gland in producing its hormones. Then ACTH, adrenocorticotropic hormone, stimulates synthesis of glucocorticoids from adrenal cortex. Then the posterior lobe secrete antidiuretic hormone that reduce the urine formation. Next one is oxytocin, contraction of uterus and related to menstrual cycle. Next is pineal gland. Pineal gland, production of a hormone is pineal gland produce melatonin hormone. Melatonin actions are metabolic rate. It reduces the metabolic rate in body, reduces temperature, antioxidant property, protect against oxidative damage. Then in the immunity, important for sleep, muscle relaxant, that is relaxes the smooth muscles, including in the digestive system. Stress does not stimulate melatonin secretion. Thus, sympathetic nervous system, the nerve supply of the pineal seems to have a control independent of most other component of sympathetic nervous system. Next one is thyroid. Thyroid secrete triiodothyronin. We know all this. Triiodothyronin T3, then thyroxine T4, calcitonin. T3 and T4 work together. Regulation of BMR, that is basal metabolic rate, body temperature, body weight, responsible for normal growth, improves mental alertness, release controlled by TSH from pituitary through stimulation of hypothalamus. Excitement and anxiety stimulates secretion of TSH. Iodine requires for formation of thyroid hormone. Calcitonin, responsible for calcium metabolism, reduces calcium level in blood. Parathyroid. Parathyroid secretes parathormone. Regulation of calcium levels in blood work along with calcitonin. Then in hypothyroidism, deficiency of calcium, that is hypocalcemia level. Then tetany, muscle twitches, spasm, convulsions, etc. has come. In hyperthyroidism, increases in calcium, that is hypercalcemia. Then this we know the what are the changes to be in hyper and hypothyroidism. Then next one is thymus gland. Thymus secrete thymosin hormone. Functions are command to immune system, production and supply of antibodies as and when required. Then alertness, immunity and defense, very important for body for fight against infections. Growth up to puberty, after which it take a backstage. Next is adrenal gland. Adrenal gland, the two parts there, adrenal cortex and adrenal medulla. Adrenal cortex secrete three hormones, that is mineralocorticoids, example aldosterone. It regulates metabolism of sodium and potassium ions, stimulates kidney to retain sodium potassium ions. Next one is glucocorticoids, example cortisons. First, concerned with the carbohydrate and protein metabolism. Second, reaction to stress, increase in BP, increases in blood glucose, then allergic reactions decrease. Next is sex corticoids, example androgen, gonadocorticoids. It is responsible for secondary sexual characteristics, general growth, healing and maintenance of body. Then adrenal medulla secretes one adrenaline or epinephrine, second one noradrenaline, third is dopamine. A role of adrenaline is important. First, stimulates, break down the glycogen in and hence increases glucose level in the blood. It increases the contractility of muscles, helps body to adapt to various situations such as stress, trauma, fasting, starvation, etc. Emergency hormone on the fight or flight hormone. Then the pancreas. Endocrine cells, islets of Langerhans. These are three cells, alpha, beta, and delta cells. Alpha cells secrete glucagon, convert glycogen stored in the blood into the glucose, then increases glucose level in blood. Beta cells secretes insulin, convert glucose in blood into glycogen to be stored in the liver and muscles. Hyposecretion of insulin causes diabetes mellitus. In this disease, liver and muscle cells unable to convert glucose to glycogen. So the level of glucose in blood rises. Hypersecretion of insulin leads to hypoglycemia or decreased level of glucose. The symptoms are weakness, tremor, etc. Delta cells secrete somatostatin that inhibit secretion of pancreas hormone. Next, the last is gonads, male and female. Female, a pair of ovaries is present in the abdomen. Ovaries produce estrogen and progesterone hormone. predominant in female, then it stimulates development of female secondary sex characteristics, play a role during menstruation and pregnancy, prepare the body for childbirth. In male, testes. It produces testosterone hormone, predominant in male. It stimulates development of male secondary sex characteristics, increases in height. It functions in sex drive, maintaining health level and the bone mass, sperm production. So, although yoga probably will not significantly alter functions of the endocrine system like growth and metabolism, it may have a beneficial effect on our stress response. Moreover, yoga poses pressurize and depressurize specific glands, and these subtle compression and decompression can regulate the secretions. Hormonal imbalance occurs when the natural balance of the hormones is disrupted. There can be an excess or a deficiency of certain hormones. The causes can be many, including unhealthy diet, no exercise, excessive alcohol consumption, medication, menopause, long-term hormone pills, etc. The best way to manage hormonal imbalance is to rectify the problem in the early stages rather than later. When the signs and symptoms become debilitating and difficult to manage despite medication. Nutrition, as we know, nutrition is the key. Nutrition being the foundation of healing, it needs special attention. Foods which can have high doses of hormones, such as dairy products and meat, should be avoided. Many hormones are used in the meat and dairy industry in increase the milk production or increase the size of animals artificially and very quickly. The hormone oxytocin is used in milk production. Women with a serious hormone problem also need to look at the state of their liver and kidney. We know these two organs are the cleansers of the body. And if they don't function properly, there is a high chance of inefficient degradation of hormones that leading to over accumulation of circulating hormones and a consequent imbalance. Foods of choice are fresh fruits, preferably organically grown, fresh salads, and organically grown vegetables. The reason organic farming is important for hormonal problem is because chemicals in food mimic the body hormones or bind to existing receptors, leading to the over-availability of endogenous hormones. Eat as far as possible unrefined food. Then we can come to yoga. The term yoga is derived from the word yuj, which means to join. Yoga is to join the self with the Supreme Self. Yoga Vasishta, one of the ancient book, beautifully describes yoga as Manaprashamanobhaya Yoga Ityabhidhiyate, which means yoga is a tactful method to calm the mind. The most of the ailments originate from the agitations in the mind, manas. Through yoga, agitations can be sublimated and mind can be brought to the state of calm or sattva. The Patanjali Yoga Sutra defines yoga as yoga chitta vritti nirodhaha, which means yoga brings the control over the hyperactivity of the mind. Then yogic correlation with, in yoga, it is 8 limbs, that is yama, niyama, asana, pranayama, pratyahara, sadhana, samadhi, dharana, dhyana, samadhi, like that. In that, yamas and niyamas, before we do asanas, we should follow some yamas and niyamas, like that. It is observing these have positive and calming effect on mind, gives emotional stability and harmony. All these have a positive effect on the endocrine system through the influence on the hypothalamus. Then Tradak and Om chanting. So Tradak, it is one of the purification. Tradaka is a yogic purification and a tantric method of meditation that involves staring at a single point, like a candle flame or like that. Then Om chanting is a very effective in this. That is, first when we inhale, then first we pay attention to the end of the vertebra. Second one at the navel center, and third in the Ajna chakra, that is between the eyebrows. So how it chant Om, we inhale and pay attention to the tip of the vertebrae, and while exhaling we chant Om, like inhale, then while exhaling Om. First Om is we pay attention to the tip of the vertebrae. Then next one at the navel center. Third one in between the eyebrows. It increases the parasympathetic tone on body, regulation of hormones, and helpful towards maintenance of homeostasis. One of the main causes of hormone imbalance is stress. And as many of us know, yoga dramatically reduces that stress. Yoga focuses on breathing, which has a stimulating effect on your hormones and endocrine system. It has been said that inverted poses such as handstand, headstand, and shoulder stand are beneficial to your thyroid, heart, hormones, and lungs. Forward bending postures such as downward dog, child pose, and forward fold are beneficial in alleviating stress, anxiety, and fatigue, all assisting in balancing hormones. It is easy to see why keeping the endocrine system working at an optimal rate is essential to maintain good health. Also, while each of the glands in the endocrine system has specific functions and can cause certain symptoms if out of balance, the entire endocrine system is a connected system that works together. If one gland is out of balance, then it is likely to affect other glands in the system as well. So, while we can choose yoga poses that impact specific glands, it is also important to do the kind of yoga practice that help to keep the entire system balanced. Asanas, while coming to asanas, asanas balance the hormonal secretions from the various glands. The twisting and bending positions of the asanas held for specific time period places specific pressure on various glands, thus stimulating in various ways like bend, stretch, pressure, pressurize, depressurize, like that, and regulating their secretions. Inverted asanas, example Shirshasana, Sarvangasana, increases blood flow to the organs, thus having a positive effect on hypothalamus, pituitary, and pineal gland. Sarvangasana, Malsyasana, Halasana are good for thyroid and parathyroid. In the shoulder stand, the neck muscles contract together with the pressure of the chin on the chest, squeeze blood out of the thyroid and parathyroid gland. Ardhamalsyendriyasana stimulate the pancreas, effective in the optimal release of insulin and glycogen, thus regulating sugar levels. Core strengthening asanas like Bhujangasana, Mayurasana, Dhanurasana influences the adrenal and pancreas. Poses like Sedubandhasana and Bhujangasana will stimulate the testes and ovary. Then comes the pranayama. Pranayama is control the breath, controlling of the breath. It helps to stretch and expels air, bringing better quality air to our lungs. During pranayama, we supply more oxygen to the lungs, which is then transported to the cells of the body. The blood supply and oxygen supply also increases to the brain and hypothalamus. We can control the stress and emotions better, as stress can disturb the functioning of hypothalamus. Pranayama can improve the hypothalamus pituitary gland as the one yoga nidra or yogic sleep, help with sleep. It reactivate the pineal gland as it secretes melatonin, which aid in preventing illnesses, delays premature aging, induce more restful sleep, boost the immune system, and promote healing. It also helps to improve a relationship between the hypothalamus and pituitary gland. It also helps balance the adrenal gland, brings a 1 out of fight or flight response. Then pranayama has a very good effect in endocrine system. During pranayama practices, there is a better absorption of oxygen in each cell of the body. Blood supply, oxygen supply, flow of unobstructed prana increases to the brain and hypothalamus, thereby improving the functioning capacity. Hypothalamus being the seat of emotions, stress and emotions better controlled. Then pranayama improves the relationship between the hypothalamus, pituitary, and the other glands. Thus, the entire endocrine system is balanced. Pranayama regulates the flow of prana through the nadis. So, in yoga, it is prana means pancha prana. That is, we all know that is prana, apana, udana, Vyana, and Samana. Then nadis. So nadis are channels through which the energy such as prana of the physical body, the subtle body, and the causal body are said to flow. Now, flow of prana has a direct relationship of various body functions. It has a relation to the nervous system and also in improved flow of nerve impulses. Further, endocrine system functioning is closely related to nervous system functioning. All these lead to regularization of the endocrine system. Then bandhas and mudras. These are the higher practices in Hatha Yoga Pradipika, specifically targeted to endocrines for progress in spiritual journey. As these influence the endocrine glands directly, it follows that they have great impact on the chakras. In this, 7 chakras are there. That is, we don't go to the details of these chakras like Mooladhara, Swadhisthana, Manipura, Anahata, Vishuddhi chakra, Ajna chakra, and Sahasrara chakra. These are the energy storing junctions. And these chakras relevant to the subtle body and thus helping to Kundalini Shakti awakening. Then mudras. Mudras means seal or gesture or mark. These are symbolic gestures often practiced with the hands and fingers, like when we in dancing positions, like mudras are there, fingers. They facilitate the flow of energy in the subtle body and enhance one's journey within. Brahma Mudra is good for thyroid and parathyroid. Singha Mudra, again, it is good for thyroid and parathyroid. Viparita Karani Mudra, it is regulation of female reproductive organs, ovaries. Yoga Mudra is another pose. It is good for pancreas and adrenals. Then bandhas, in that 3 bandhas are there. Moola Bandha, it is good for gonads. Jalandhara Bandha, it is good for thyroid, parathyroid, and thymus. Uddiyana Bandha, it is good for adrenal and pancreas. Certain yoga poses can stimulate the overall system and they help maintain optimal function. This leads to consistent production and distribution of these hormones around the body. Yoga focus on breathing is also beneficial for stimulating the endocrine system, helping it to function more effectively. Hormone imbalance happens due to stress as well. Yoga's role in stress reduction has been well documented through a number of scientific studies over the years. Incorporating pranayama and meditation techniques will also add to the benefits of your asana practice. It is very important to mindfully do the asanas and get all the attention on the endocrine system while practicing. A regular practice of Bahiranga Yoga, that is Kriyas. In yoga, it is Shat Kriyas are there. In our Ayurveda is also Kriyas, like that. Shat Kriyas are there. It is Dhaudi, Vasti, Tadhanedi, Nauli, Tradakam, Kabalbhadi. These are the Shat Kriyas. Kriyas, Asanas, Mudras, Bandhas, Pranayama help to maintain optimum functioning capacity of the endocrine glands. Thus, both physical and mental health balance facilitates the maintenance of homeostasis in the body. Antaranga sadhana establishes harmony at the chitta level, which then percolate to all the levels. Harmony at the brain level leads to stabilize harmonious functions of the neuroendocrine axis. Bhakti yoga practice, that is the chantings, bhajans, etc., lead to emotional culturing. Since extreme emotions are removed, they no longer adversely influence the hypothalamus. So, pituitary functions are also not disturbed. All yogic practices influence the endocrine system in a positive way, thereby leading to a balance, harmony, and integration at all levels. Homeostasis is maintained within the body with all systems functioning, optimum leading to an overall well-developed personality, general well-being and good health. So, certain yoga poses can stimulate the overall system and help them maintain optimum function for natural relief from the hormone-related symptoms. Try adding these poses to your practice. First one is Bhujangasana or Cobra pose. Second, Sedubandhasana or bridge pose. Malasana or garland pose. Shashankasana or rabbit pose. Ushtrasana or camel pose. Ardhachakrasana or half wheel pose, Gomukhasana or cow pose. These are some of. Then pranayama, the recommended pranayama breathing exercises for hormonal imbalance is mild Kapalabhati, that is lung cleansing, Anuloma Viloma pranayama, that is Nadi Shuddhi pranayama, alternate nostril breathing, Ujjayi pranayama, that is ocean breath, and Brahmari. Now, let's see, this is Bhujangasana. So, let's see how to do Bhujangasana. Next one is Sedubandhasana. This is the pose, and let's see how can do Sedubandhasana. Next is Malasana. This is the pose. Let's see how to do Malasana. വരുന്നില്ലേ? അയ്യോ. പിന്നെ ഞാനിത് പറയുമെങ്കിലും ചെയ്യാറുണ്ട്. Audio keep your feet and hips distant apart on the mat, ensuring your knees and ankles are in a straight line. Step 2, place your hand by your side, inhale and press your feet into the ground, gently lifting your hips. Slowly lift your lower back, middle back and upper back of the mat. Step 3, now gently roll in the shoulders, touch the chest to the chin without bringing the chin down, supporting your weight with your shoulders, arms and feet. Stay there for 5 long breaths and while exhaling, gently release the pose. Get your hips back down. Then the next one is Malasana. So step 1, bring your feet about mat width apart and slightly turn out your toes. Step 2, bend the knees and lower your hips toward the floor to come into a squat position. If your heels lift from the floor, place a rolled blanket or towel underneath that. Step 3, take your upper arms inside your knees, bending the elbow to press against your thighs and join the palms together. Step 4, keep your spine straight, your hips moving toward the floor and your shoulders relaxed away from your ears. Stay in Malasana for 10 long breaths. Next one is Shashankasana. Next is Ushtrasana. This is the camel pose. How to do Ushtrasana? Step 1, kneel with your body upright and hips tucked over the knees. Rest your hands on the back of your pelvis with your fingers pointing to the floor. Step 2, rolling the shoulders back, leading with the chest. Start moving your hips and thighs forward to gently lean back. Your chin should be slightly tucked toward your chest, keeping your gaze forward. Step 3, if you are comfortable here, you can take the pose even deeper. Reach back and hold on to each knee, each heel. Keep your thighs perpendicular to the floor with your hips directly over your knees. Take 5 long deep breaths here. Step 4, to release the pose, lift up through your pelvis, keeping your lower spine long and gently sit back in child's pose. So these are the important asanas to thyroid, parathyroid, these are the endocrine system. Then add these pranayama practices. So if we can doing regularly these pranayama practices, you can balance the hormones as well, all the hormones. First of all, first do Kapalabhati. It is active exhalation and passive inhalation. Let's do Kapalabhati. Come to Sthiti in Siddhasana or Padmasana, both hands on the knees, completely inhale and completely exhale out. Inhale in and start exhaling out forcefully. Give the strokes, like 10, 30 strokes at a time you can do. So, we can practice the Kapalbhati once or twice. Am I audible? Can you hear me? Hello? Can we practice the Kapalbhati?
Yes, doctor.
Anyone?
Please proceed. Please proceed.
Okay.
And we are exceeding the time. It's 9:15.
Okay,
So
okay. Then just I mention what are the practices. That's all. Okay. If we do it, then it will take.
We have to. The Zoom will end by 9:30.
Okay. Then next one is Nadi Shuddhi. So let's give a glance how to do that. Okay, just alternate nostril breathing. Cross your leg in Padmasana or Sukhasana. Left hand in Dhyana Mudra and right hand in Nasika Mudra. That is like this, Nasika Mudra. Then the index and middle finger, you close this thing. Now close your right nostril with your right thumb and slowly inhale from your left nostril, then close your left nostril and exhale from the right. Then inhale through the right and close the right and exhale through the left. This is one round. Continue 4 to 5 such rounds. Make sure your spine is erect. Another practice is very good practice. It is Ujjayi. Inhale through the nostrils and while exhaling, a little friction at the throat. Lower down neck, a hissing sound. Inhale up, inhale. Just you inhale, then exhale, lower down the neck with a hissing sound. That is like this. Inhale, then while exhaling, lower down the neck, then like the ocean sound. Next one is Brahmari. Touch the tip of the tongue to the upper palate. Then inhale. While exhaling, apply the Shanmukhi Mudra or close the ear panna and produce the nakara, the humming sound. It is like this. Tongue touching the upper palate and close the ear panna. Then inhale, while exhaling, produce nakara. Like like this. If we have time, then we can have practice this thing. That will be very good. Then through breathing, mindful movement and time away from hectic lives, yoga brings you into the present moment, bringing your body into a sense of calm, lowering stress levels, and bringing hormones into a happier, healthier balance. Thank you.
Thank you very much, Dr. Geeta. So, Dr. Vasanthi, can we have a quick review? Dr. Vasanthi? Vasanthi, Dr. Kelkamo. Meanwhile, our thanks to Dr. Devidas Vellodi, State Committee member, Dr. Sadat Dinakar, who had just joined, and then now I think he has left. So for being with us. Dr. Vasanthi. Dr. Ganga, was Dr. Vasanthi ille?
Yes, I am trying to unmute Dr.
Yeah,
Valsala.
Please carry on. We are our time is going fast.
Yes.
Your
Thank you, Dr. Jaimon, Dr. Joyce, Dr. Valsala Devi, Dr. Chindu, and especially Dr. Geeta. Thank you very much for your presentation. I congratulate you. You are covering almost the anatomical, physiological, and pathological aspect. You are trying to do it better way. Thank you once again, Dr. G.K. Menon and Dr. Geeta, to select this subject for the newcomers. I have a humble request. Your theoretical part is very good, but I have a small opinion. During practicing yoga, am I audible?
Yes, ma'am.
Yes.
The inhalation position, I am completing my PG diploma only, not MSc, even though I am practicing last 26 years. I think the inhaling position, the abdominal muscles should be go inside, then hold the breath, then exhale, it will be come back to the normal position. അങ്ങനെ ഒരു അച്ഛൻ ക്ലാസ് എടുത്തപ്പോൾ അത് വ്യക്തമായി പറഞ്ഞിരുന്നു എന്ന് തോന്നുന്നു. കാരണം വി ആർ ഡോക്ടേഴ്സ്, നമ്മൾ ഈ കാണിച്ചു കൊടുക്കുന്ന പോസ്റ്റേഴ്സ് നിങ്ങൾ ഡോക്ടേഴ്സിനെ കൊണ്ട് തന്നെ ഒന്ന് അറ്റൻഡ് ചെയ്യിക്കുകയാണെങ്കിൽ കുറച്ചും കൂടി നന്നായിരിക്കും. കാരണം ആ പോസ്റ്റർ കാണിച്ചതിൽ വെറുതെ ഫിസിക്കൽ പോസ്റ്റർ മാത്രം പോരല്ലോ ഡോക്ടർ ഗീത. യുവർ പ്രസന്റേഷൻ ഈസ് വെരി ഗുഡ്. യു ആർ ട്രൈങ് ടു ഡു ഇൻ ബെറ്റർ വേ. ഒത്തിരി ട്രൈ ചെയ്തിട്ടുണ്ട്. വൺസ് അഗൈൻ ഐ ആം കൺഗ്രാജുലേറ്റ് യു ഓൾ ദ ടീംസ്. താങ്ക് യു.
Thank you, Dr. Vasanthi. Thank you for the suggestions and updations. Can we have you, Dr. Anavadya, for the vote of thanks? So any questions, if you have any of the participants, if you have any questions, you may please contact Dr. Geeta Menon for the answers, or you can post the questions in the AMA Ernakulam area group. Your questions will be answered by Dr. Geeta Menon. Sorry, we cannot take the questions now because the time is up. So Anavadya, for the vote of thanks, please.
Okay, ma'am. ആദ്യമായി ഈ വൈദ്യസമീക്ഷ എന്ന പ്രോഗ്രാം തുടങ്ങി വെച്ച AMAക്ക് എൻ്റെ പേരിലും എല്ലാവരുടെ പേരിലും ഞാൻ നന്ദി പറയുകയാണ്. അതുപോലെ തന്നെ ഇന്നത്തെ ക്ലാസ് എടുത്ത ഗീത മാമിനോട് എൻ്റെ വ്യക്തിപരമായ പേരിലും AMAയുടെ പേരിലും നന്ദി അറിയിക്കുന്നു. ഇനിയും നല്ല നല്ല ക്ലാസ്സുകൾ നമുക്ക് വൈദ്യസമീക്ഷയിലൂടെ കേൾക്കാനും കാണാനും കഴിയട്ടെ. ഇതിൽ പങ്കെടുത്ത എല്ലാ ഡോക്ടർമാർക്കും നന്ദി.
Thank you, Anavadya. So that was a great session, like very deep into the theoretical and as well as the video demonstrations, and wish and hope it will be helpful in the clinical practices of all our doctors. Thank you, Dr. Geeta Menon, for that. We look forward to having more classes from you. Dr. Harish, may I have you, Dr. Jaimon, Dr. Ellaru und academic council, but I can't call any one of you because we have to close the session. So thank you one and all for being here with us, and we expect you to be there by the next first Sunday. We'll be having one more scientific session, which will be, the topic will be announced shortly. Thank you, one and all, and I request with all your permission, I declare the session closed. Sajin, can end the meeting, please, Sajin.
Thank you, ma'am. Good night, everyone.
Good night, everyone. And
Good
the
night.
video is streamed live on YouTube. Anyone can watch for the further clarifications. It is available on my YouTube.
Okay,
The
okay.
link is posted in the group.
Okay, ma'am. And one more suggestion, next class, we should have more interactive sessions. That is what our main aim is, according to academic session. So interactive session should be there at least for the last half, like 15 minutes. So hopefully from next session onwards, we can see more interaction by each doctors. Thank you, everyone.
Okay, ma'am.